Hi, everyone. It's Hannah Wendt, the Director of Operations here at TruDiagnostic, and we are back with another Q&A session with Dr. Jason Saunders. I'm really excited about the project that Dr. Saunders has going. We're going to talk about everything he knows about hyperbaric oxygen chamber therapy and his exact protocol, why we're looking at it, what it means as it relates to epigenetics and aging. So Dr. Saunders, I want to start off just by you telling our listeners a little bit about yourself and your background. You know, we've personally known each other for some time now, and you've worked with TruDiagnostic forever. So would love to have a snippet of your background.
Absolutely. So I've been in practice for about 18 years. We've been doing hyperbaric in our clinic for about 15 or 16 of those years. And originally I had stumbled upon hyperbaric because of an injury that I had to my lower back. And hyperbaric was the thing that actually helped me regain normal neurological function in my leg that I had lost from that disc injury. So over the years, we slowly started kind of bringing it into our clinic. And eventually, we started seeing that a lot of the patients that weren't responding to, what our standard of care was in our clinic, we would use hyperbaric for those folks. And sure enough, one by one, they kept responding. And I started thinking to myself, why are we waiting, so long to introduce hyperbaric? Why are only the patients not responding to our standard of care getting it? Maybe everybody should. And if we moved it sooner and sooner into our protocol, perhaps we would have to do less and get people better even faster. And sure enough, that's really what we started finding. And so we were getting really good results. And a lot of our patients would say things like, hey, do you know somebody in Chicago? Do you know somebody in California? Do you know somebody in Arizona? And we really didn't. And when we started looking around, we didn't really find many people either. So that brought us on a mission to really start kind of bringing this out more into the world, starting to teach it. So, we teach certification courses. We work with different businesses, building, hyperbaric clinics, because it is such an amazing tool. It's such a powerful tool. And yet, after all these years, it's still so misunderstood that I think it's become underutilized as a result. And so we're doing everything we can to really try to get it out into the world. This research project really came from, going back to school for PhD in Miami in molecular biology with a study in regenerative medicine. I think that hyperbaric is going to play a critical role in chronic inflammatory diseases and mitochondrial dysfunction. A lot of the things that we know are ultimately at the core of so many chronic illnesses that so many people suffer from. So we wanted to do this project as a way to not necessarily treat sick people with a very specific illness. Actually, we're looking at predominantly healthy people, and we're trying to measure inflammation, cognitive function, methylation, telomeres, all of those pieces to understand, even the healthy person, wouldn't they still benefit from a little bit more oxygen? And so, that brought us to you, and you said we've known each other for years now, and we're excited. The research is finally, I guess, working its way through. We're almost towards the end of our data collection, so we're really excited to see the results.
Yeah, appreciate that background. I think we first met at the Hyperbaric Oxygen Chamber, your conference that you put on in Florida a couple years back, met in person. Mm-hmm. And I never knew about HBOT, right? Before I was kind of open to this preventative regenerative space. I think it's an amazing therapy that a lot of people can benefit from. But that conference was really, really eye-opening, and I watched, and listened to your lecture. So I love how you do the education part of it as well, right? Okay, here's the data. It works from a preventative model. Now let's work with you and work together to get this up and running in your clinic and actually teach people the best protocols. So super excited. Our main focus today with you and I chatting is going to be your research project. But for the listeners who may be a little bit new to this space, I'm sure they've heard the word HBOT, or the acronym, I guess. It's like this buzzword. It's really trendy right now. But can you just talk about what hyperbaric oxygen chamber therapy is, and what's the history, kind of what that process looks like?
Sure. So not that we'll give you the whole history, but it's been around for over 300 years in different forms for different reasons, and it's one of those devices that it never really sort of hit a tipping point the way many others have. Like, cryo sort of comes out of nowhere and, hits this huge tipping point, or, ice baths and saunas and, also all these great tools that sort of come out and, their uptake is pretty fast. Hyperbaric's been around so long and its uptake has been actually very, very slow until recently. And I think, again, a big part of the reason for that is just it's been very misunderstood in terms of why it works and how it works. And the most simplest way to understand it would be that I think people understand elevation a little bit easier. So, if you've ever gone to Denver or skiing or, mountain climbing in any way, that it gets harder to breathe at elevation. And the reason isn't because there's less oxygen percentage. Oxygen is 21% of the air that we breathe, no matter where we are on planet Earth. The difference between, let's say, being in elevation or being at sea level is the amount of pressure. So there's pressure of our atmosphere, and the pressure at sea level is called 1 atmosphere. And it's a fraction of that when we go up in elevation. And so at 1 atmosphere at sea level, you have just enough pressure to basically oxygenate your red blood cells 100%. As we leave sea level and we go up in elevation and we lose that pressure, what we're really losing is pressure is the driving force to get oxygen into your circulatory system. And so as we lose that pressure, we can no longer saturate our red blood cells the way we normally can. And as a result, we have the perception that it's harder to breathe because we're getting less oxygen into our system. We all know that the long-term adaptation to that would be increase in red blood cells. So if you stay at elevation long enough, your body will start producing more red blood cells because you can't saturate fully. So your taxi cabs are partially empty. You need more taxi cabs, more red blood cells to deliver that oxygen throughout your body. Hyperbaric is the exact opposite of that. So instead of going up in elevation, you're actually going below sea level. So what we're doing inside of a chamber is creating an artificially increased atmospheric pressure. And again, pressure is the driving force for oxygen absorption. So as you increase the pressure around the person breathing, you don't feel that pressure on your body. You don't feel it on your arms or legs. You don't even feel it in your breathing. You'll feel it in your ears. You have to clear your ears, kind of like when you're on an airplane. But ultimately, you don't feel the pressure of the chamber. But as you breathe, because there's more pressure, you're actually driving oxygen into the circulation at a higher level than normal. And the thing that makes hyperbaric special and that pressure special is that right now you and I are relying on red blood cells to deliver that oxygen. When you're in a hyperbaric chamber, you're actually bypassing the red blood cell carrying capacity, and you're starting to dissolve oxygen into the plasma, into the liquid portion of the blood. Normally, the plasma carries very little oxygen, about 3 milliliters per liter of blood. But under hyperbaric conditions, we can increase that up to 20 times as much. And so all of a sudden, the plasma becomes this unused reservoir of potentially enormous amounts of oxygen that could be dissolved into circulation and then delivered to cells and tissues because of that artificially higher atmospheric pressure. And so that's really that's the key. Pressure drives it. And by using this tool, we're able to create that surplus that really nothing else can do. Once you have that surplus, the things that can change are endless, from decrease in inflammation, improve mitochondrial function, neurogenesis, healing of the nervous system, stem cell releases, hormonal changes, neurotransmitter changes. There's an enormous amount of healing, recovery, and regeneration that occurs because of this increased oxygenation of the body from the chamber.
Yeah, that's a great explanation. The best I've ever heard. So, no, that's a great just kind of overview of hyperbaric, a little bit of the history. It's great that it's been around for so long, and now we're moving it into more of that clinical care. I did a hard chamber once here in Lexington. I have an MD who's a friend and a great healthcare provider, but I've only done it once, and I want to do it again. Like it was just such a great experience. I see people going inside of these chambers and working, or I read a book, but being, super productive in the chambers as well. And we'll get into the protocol and what that looks like. But you mentioned some of the benefits that you just saw from the hyperbaric oxygen chamber. So, obviously with our study, we're looking at epigenetic markers in the hyperbaric. So broad epigenetic markers. Hopefully maybe we'll see what mechanism of action that hyperbaric is working on in the body, but we're also going to obviously relate it back to aging. So why are you excited about hyperbaric and aging? And then maybe give us like a case study or something clinically, you've seen that really just made your jaw drop.
Sure. So, I've been, I guess, selfishly, I'm interested in the aging process and, just taking care of myself and wanting, we watch our family members, our loved ones age, and we think like, I want to get older because I want to stay on planet Earth as long as I can, but I want to feel good. I want to do whatever I want to do when I wake up every day. And I don't want limitations, at least physical or mental limitations to stop me. So, that's always been sort of in the background of, my thoughts process. In terms of hyperbaric, what's interesting is, it sort of got clinical legs, if you will, through diving medicine, through decompression sickness, decompression illness associated with scuba diving. That's really the background in terms of like the more recent uptake of why hyperbaric started to grow. And then from there, it really, if you look at the traditional uses of hyperbaric, there's 14, FDA approved indications to use hyperbaric. Gangrene, necrotizing fasciitis, osteomyelitis, post-radiation burns, things like this. And when you really start to look at them, you start to see that these are basically all very severe, either life-threatening or certainly limb-threatening diseases. Mm-hmm. And as a last case scenario, when nothing else has worked, they consider to try hyperbaric. And in many cases, it's actually very successful. So you start thinking, just like I was saying, we would use it only in those cases that didn't, respond to traditional treatment. And you start wondering, well, why are we waiting? If oxygen works, something so safe and so simple, for something so severe and life-threatening, God, why wouldn't we move that sooner and sooner into that protocol? But for a lot of reasons that we won't get into, it's just not in the traditional sense of the use of hyperbaric. But when you really study, and that's what we teach when we teach the certification classes, is the mechanisms of action. Because if you understand why hyperbaric is working, like at what level cellularly, and that's really what I went back to school to try to figure out, was, if you understand what it's doing on a cellular level, mm-hmm. and you really look at all the cases, whether it's on label or off label, we're not treating, even if you talk about gangrene and, necrotizing fasciitis and osteomyelitis and necrosis and burns, we're not treating any of those illnesses. All we're really doing is upregulating the healing and regenerative process of the body. The body has the capacity to heal itself. It always has. When we're severely injured, or if our body is compromised in a way that's not allowing us to heal and regenerate properly, all of a sudden we start breaking down faster than we can rebuild and heal. And I think that aging is no different than that. We hit a point, where growth factors start to decline and stem cells start declining. And as a result, life is just beating us up and we're getting worn down and we're not able to heal and regenerate as fast as we once did, just like when we were kids. And so, I look at this whole process and I say, listen, the same thing that we're doing for gangrene and osteonecrosis is the same thing we're doing for TBI and concussion or MS. We're not treating any of these diseases. We're just helping the body be more proficient at healing and regenerating. And then if we look at aging, it's the same thing. We're just stress and life and all the things that go on. It's the wear and tear that we're slowly, it's no secret. We don't live in the cleanest, stress-free environment, here. So as we're being overoxidized, as we're being undernourished, as the stress levels in our life continue to increase, as we don't sleep as well as we once did, all the things that go on in a standard lifestyle, we're aging faster than we need to, and I think that oxygen is one of probably at least a dozen ingredients that we could be adding to people on a regular basis that could either reverse, depending on where you are, certainly slow down the aging process. And just, I don't want to live forever. Mm-hmm. I'll take like 120, 130. But really what I want, and it is what everybody wants, we want quality of life, mm-hmm. right? I want to just not wake up one day and that was it. But I want full quality of life every day up until that particular moment.
Yeah.
Exactly. And so what are the things that we could be doing? And we all know there's the diet piece and the exercise piece, but what other supplements, what other modalities, how else can we help balance this world that we live in so that we can maintain or certainly improve quality of life over the years. I think hyperbaric happens to be one of those for sure.
Sure. Yeah, that's interesting. So I have to know, I'm sure everyone else is wondering too, how often do you do it? Like, do you have one in your house? I know, you can get some. Okay,
yeah.
you do?
Yeah. So, I mean, we have 2 clinics. So I have 5 hard chambers in both of, between all the clinics. And then we use a soft chamber in the house. Mm-hmm. And I think, again, that's part of the research is looking at the difference between like higher pressure and lower pressure. We could talk about that. But, when we're trying to treat somebody who's pretty ill or, has pretty compromised system, sometimes, not all the time, sometimes more pressure is very meaningful. Mm-hmm. And if we have somebody who's pretty healthy and looking to just sort of optimize, their biology a little bit more, the lower pressure certainly should be enough, in my opinion.
Yeah, maybe you don't need the hard chamber then.
Exactly.
No, that makes sense.
So, and again, so one of the questions I get all the time is, which one do I, like as a clinic, let's say opening a clinic and adding hyperbaric, should I get hard chamber? Should I get soft chambers? The questions are always like, well, who are you treating and what are your goals and what kind of, what's your patient population and what are you trying to accomplish? But at the end of the day, the answer is we don't know because there hasn't been enough research comparing the two to really fully understand that. And that's a big part. That was the driving force for this particular treatment protocol, to look at the differences side by side between the two so we can understand, who should potentially use which one. But to answer that question, I probably do about 2 hours a week pretty consistently all year. And then 2 or 3 times a year, I do like a 30-hour protocol. So I'll do like 30 hours over the course of maybe 3 weeks.
Oh, wow.
Pretty intense. And I do that a few times a year. And then I just fill in the gaps with a couple hours here or there.
Yeah. No, great to understand and learn more about your protocol too, because I think everyone listening is definitely fascinated and wants to get involved. And you mentioned the limitation of the data on, the hyperbaric. What's the protocol? What should we do? Yeah. For those who are listening and very familiar with the research in this space, there's the study that came out from Israel looking at hyperbaric oxygen chamber therapy and then, the telomere lengthening and methylation. So I want to, hone in on that one. Like, what are the hopes for HBOT? Like, what did that study open your eyes to, or did it tell you anything, new or different, or confirm maybe some hypotheses?
I think definitely confirm some hypotheses. Again, in traditional hyperbarics, the vantage point is so small. It's like, here's these few people that are very, very sick, and we charge a ton of money for these really intense treatments in the hospital for people who are literally about to have surgery or potentially die. And so, the potential for hyperbaric to help is so much bigger than that, and should be so much more cost effective than that. Of course. So both, exactly. And so I think the more of this kind of work that's done, the more likely that's going to be the case. But I think that something like telomeres, which, again, I don't know how definitive telomere length is on, let's say, longevity definitively, but, so shorter telomeres are associated with shorter lives, right? And longer telomeres are associated with longer. And so it's certainly a correlation that I think is important. Underneath that, I think the idea of looking at the epigenetic profile is equally, if not potentially more important, because we could really start to see what's getting turned on, what's getting turned off, and are we shifting this person back into what we would define younger physiology in a way to say that their capacity or their ability to heal and regenerate is improving as we're potentially improving the age of their cells. And so that's why I really want to, we're looking, that study certainly helped me in defining the parameters for the study that I'm doing right now. And my hope is to create a similar, slightly different protocol using similar thought process, and then just sort of opening the range of what we're looking at, outside of just telomeres alone, just to say, again, low pressure, high pressure, here's a protocol, and what are we seeing at these different amounts? But I'm quite positive that we're going to see some version of similarities with this improved cellular aging, capacity.
Yeah, I think that the Israel study was a good stepping stone, exactly. Right? It gave you kind of like a basis to work from. But as you mentioned, when you look at all of these biological age markers that are available and ways to interpret your biological age, telomeres are very low on that list. So, sure, they're important, don't get me wrong, but we need to investigate more into the actual aging. So the epigenetic methylation markers alone, and then using those algorithms to interpret that, I think can give us a lot more insight. And there have been a lot of, HBOT studies suggesting these epigenetic regulation changes in,
right.
Several diseases, chronic fatigue, different pain syndromes, and others. But your trial actually adds on another layer. And then, really these next questions I'm going to ask you have everything to do with your trial and, the different pressures and how you set it up. You also pair the epigenetic data that you're looking at with the neurotracks, I think it is.
Yeah,
neurotracks.
Mm-hmm.
So yeah, if you just want to give like a good overview of your study, what you're looking at, like why you chose these markers, why we should be so excited for these results to come.
So I did a few things, and some of these they're just limitations of studies in general too. One layer that I really wanted to focus on was not treating disease. So, we basically have excluded people that have had any specific diagnosable, autoimmune, cancer, all the, we try to really limit the invitation to the study to people who are basically, I'd say, mostly asymptomatic and certainly not necessarily diagnosed with anything specific. And part of the reason for that is to say that I don't want this to be associated with, here was this person's disease and these were the benefits that we saw. I really want this to be looking, I want people to understand the concept of, we're taking people who you would pick off the street and say, well, this person's, pretty healthy, average, which I might say the average American isn't very healthy, but, you might say that, they're not diagnosed and they're, in the traditional word, meaning of the words, they're quote unquote healthy. And so, but does that person still have more inflammation than they ought to? Does that person still have a lower mitochondrial function than they should? Does that person still have, lower cognition and poor memory and too much stress and, all these different things? And I'd say most likely yes. And so could we take the average American and improve their health using a tool like this? So that was one layer. Another layer that we did was say a lot of the research done in hyperbaric has been done at 2 atmospheres or more. There's definitely some research done at lower pressures, but not nearly as much. And so I wanted to take basically the lowest end of the spectrum, which is 1.3 atmospheres, which is what a soft chamber would typically run at. And I wanted to compare that with 2 atmospheres, which is what it's not the highest it goes by any stretch, but a lot of the research, especially the group out of Israel does a lot of their research around 2 atmospheres. And so now we have a side by side saying, listen, we're going to look at, and we're looking a lot. We're looking at, cortisol, insulin, testosterone, growth factors. So we're looking at growth factors. We're doing a 48 panel cytokine test. We're doing the neurotracks, computerized cognitive assessment, looking at executive function, reflex memory. And then of course we're doing the methylation panels and telomeres, with you guys. And so the goal being here's a very broad scope, view of what this sort of healthy person is operating like. And can we see any improvements across the board? I don't think this study ends at, right now. This is sort of I'm asking a lot of different questions, trying to mostly see, I'd call it more like a pilot. We're asking 100 different questions at 2 different pressures. What are the things that we're seeing changing, and how do we start to hone in on that and now on a deeper level and in bigger cases? I would need an N of, hundreds to associate, healthy people getting improvement. So, this to me was a way for us to open that door, hopefully have a dialogue and some answers that are interesting to create more questions and further the research in that same direction.
Right. I mean, you can't start without a pilot trial, right? I think having the data set, having all of those metrics that you just mentioned that we're looking at, I mean, you're going to see so many different correlations and, causations and different pathways that really, the hope is after that you get to pick the one you want to hone in on and then do further research and see down the line, like how can that affect our biology? So it's just, putting proof in the pudding. It's going to be really the first ever study looking at all of this. So, the proof of concept study, I like to call these more of these introductory trials. So, and then what becomes really interesting as well, I don't know if you have any plans for this. I'm going to speculate. However, if you want to extend the trial, right, you can see your results from everyone who's been doing the hyperbaric and all this testing. Once you receive those results, do you have any plans on like putting people through different arms or kind of, just looking at the data and taking a break for a second?
Definitely looking at the data and taking a break for a second.
Yeah.
Big project. But I will say, I mean, I think, so we did basically, baseline testing, a round of treatment, testing after that, and then about a month break. And then they did a whole nother round of testing. Then we checked them again across the board after that second round of testing. And then we waited about another month after that to do, post, how long do some of these changes stay with these people,
Right.
Again, so just asking a lot of questions in that way. I do think that once we start to see that, lower pressure did X, Y, and Z and higher pressure did this and what some of those differences were, within the study, we also have the control became a crossover. So we took the control group and we cut them in half and then we put them back through, the different arms just to start to, remeasure and, see if we can create some sort of, reproducibility right away.
Sure. But I think, that's great. That's a part I didn't know you were doing.
Again, I guess once we have that and we start to actually assess it, I haven't seen any of the data yet. So, in the next few weeks, we'll be getting all of that back. And, I imagine at that point, I would like to do a like a multi-clinic study, maybe not as broad, but 5 or 6 or 8 different clinics, all choosing some of the higher points, and collecting, a lot more data on a lot more people in that way. The other reason, and one of the reasons that we are using you guys was because we're going to learn so much more. Like even between when I started talking to you about possibly doing this study to the point we are right now, we already have identified new methylation markers and what they mean and where they're, and that's going to be something that'll continue on. And so, at some point we're going to learn that this marker is like super meaningful for whatever I'm interested in looking at in aging. And we're going to be able to go back, look, compare and say, is this worth a further study? Right. And so because we'll have that database of info and be able to, cross-check that, I think it's going to be an incredible amount of info that we can continue to look at over time.
Yeah, I like the idea of you going after all of these clinics, and obviously, you have your connections with you, educating and putting these chambers actually in clinics. So I think you would easily be able to gather that data. But it's almost like a small validation, right? Okay. Just kind of going through and saying, okay, yeah, this aligns. We see these massive changes here. I think that could be interesting to a lot of people. And again, just pushing that education out there, letting them know we see X, Y, and Z changes, and then you can market it in such fashion. And then getting to the end here, Dr. Saunders, what are the next steps for you? I know you said you're going to gather the data, take a break and look through that. Is there anything else you want to add or, tell our listeners today?
So, I mean, I think that I started doing, well, it's a long story. I went back to school because the level of questions that I get in the courses that I teach, I felt like I owe the people who are coming to me to learn, the best answers that I can give. Mm-hmm. And so, me going back was really an attempt for me to go back and really understand cellular biology at a level where we can start making more sense out of what we currently knew. As getting through that research, or getting through that program, takes me to doing the research. I really wanted to look at what my opinion was the most important questions we can answer, which is not how does hyperbaric treat disease, but how does hyperbaric improve the regenerative process of our cells? Because that's what we can apply to literally every human on planet Earth. And so I would say that the next steps would be more in terms of going in that direction. It'll be, where is hyperbaric most influential? How do we really capitalize on the benefits of that? And as you well know, and I well know, and anyone who's in this space also knows, there's not a single treatment available to us that will do all the things. Each one has value. If it didn't have value, we wouldn't be talking about it. We wouldn't be wasting our time with it. So whether it's, red light or NAD or methylene blue or like all these amazing tools that we have access to, and how they interact with each other, where's the synergy? And so, the next step is actually going to be starting to look at combined therapies, saying like, let's take a mitochondria and see how many different ways we can shift its physiology. Because I think that's where the future is. I'm focused on hyperbaric because I'm passionate about it. I love it. I teach it. I use it, all the things. But I really want people to have meaningful protocols, not just in hyperbaric, but actually, how do we take a multi-therapeutic approach to aging, right? Just to healthy people. How do I keep healthy people healthy? Or how do we take asymptomatic humans and make them actually healthy people? Those kinds of things. So the future will be, that multi-therapeutic approach to primarily inflammation and mitochondrial function. Because I think that that's really the two pieces where if we were to have massive impact there, we would see huge changes in the path that most people are on.
Yeah, definitely. No, I want answers to all of those questions too. I want a multi-modality treatment served on a silver platter saying, you'll become this much younger if you take X, Y, Z. So I think that's a huge, huge need and something everyone would be interested in. But this has been amazing. I really want to thank you for your time, Dr. Saunders. For people who want to learn a little bit more, or they're like, I need a review on hyperbaric, I want more resources and assets, where can they find you, or, a certain website? So our main website's hbotusa.com, HBOT USA. And then we have a YouTube channel, which is also HBOT USA. I think we have like Instagram and all the social medias.
Other
we'll
things
link it out
that are
too.
all HBOT USA, whatever it is, they're all HBOT USA related. I put out a ton of videos. I think I have probably a little over 200 videos on YouTube, all on different topics. Some of them are for, the average person just to start understanding what hyperbaric is. Some of them are for clinicians that are looking for, does this work for this or does it work for that? Different research reviews. So we have a lot of content out there trying to help that educational process. And then obviously if anybody was like, I think I actually really want to do this, or it's amazing to me how many people are already doing it, but not necessarily taking the time to go through any of the certifications or the coursework. There's so much information to be learned in an environment like that. And so certainly, checking out some of that work that we're doing. And if you're so interested, join us for a class one day. Sure. Yeah. We'll put everything in the show notes. That way people know where to find you and contact you if they have any questions. Highly encourage checking out all of his videos. They are great. But if anyone has any comments or questions, and we need to send those to Dr. Saunders, we absolutely can do so, or you can comment below. But yes, that is all we have for you today. Thanks again, Dr. Saunders. I really appreciate your time. Thank you. I appreciate it. Nice chatting.